Hi, everyone, and welcome to another guest expert call on the Solve Network. My name is Shane Borza, and along with my co-founder and co-host, Benjamin Goss, we're excited to have you here. These calls are the first and third Thursday of every month. And if you'd like to connect with experts in different industries and get a chance to learn from them and also interact with them one-on-one and get your questions answered, then please contact us by going to thesolvenetwork.com. We'd love to have you live on the call. And if not, you can always join our mailing list and we will send you a recording and you can always listen to it afterwards. If you are an expert in something and you want to come on here and give a presentation yourself, we'd love to have you on. Please contact us, as I mentioned, by going to thesolvenetwork.com and let us know. We'll put you on the calendar. Tonight, I'm really excited to have Dr. Kyle Buth on, who is not only one of my doctors, but also a friend of mine. I've known him and been a client for a few years now. And he is a medical doctor, chiropractor, physician, coach, and also a co-owner of Elevate Sports and Healthcare, which is a great place that kind of mixes both the kind of physical training with sports medicine. And he's going to be talking to us tonight about not only what they offer, but also the philosophy they have, which I think is really unique. And having been an athlete my whole life and having had lots of injuries over the course of my life, I've been to a number of different practices. And I can definitely say that this kind of holistic, forward-thinking, biohacking perspective has not only helped me, but I know it's helped a lot of other people. So without further ado, I'm going to let Dr. Kyle take it away. And I'm really excited to listen to your presentation.
All right. Thanks, Shane. I appreciate it. It's been a long time coming, and we've talked about this for I don't know, a few months now. Getting on and speaking about what we do here at Elevate, and glad we finally got to reconnect and do this. But this is what we're passionate about here. We're passionate about fitness, performance, and healthcare, and we think that the way that these things are delivered, fitness, performance, and healthcare, they're gonna change over the course of the next few years. There's going to be a blending of all of this stuff, and it should, because these things they're actually just a big spectrum of each other. If you think of healthcare, fitness, those things actually have a lot to do with each other when you're looking at someone rehabbing. So, Shane's gone through some bumps and bruises, like he said. There's times when you start integrating a movement back into a patient, and it's just basically a regression of a fitness exercise. And I think that's really important, so that healthcare providers, whether it's PT, whether it's chiropractors, athletic trainers, whoever it is that's going to be helping, they have an understanding that at some point you're getting back into exercise, or you're getting back into movement. So if you have a team around you that you can refer to, or you have the understanding yourself, and you can get back into those rehab type movements a little bit quicker. So again, our whole philosophy, oops, that wasn't supposed to show up like that. Well, there's my clinic room. Sorry, that wasn't supposed to show up. There's a couple of things behind there. Basically just says my name and my credentials and stuff, but it's my clinic room. This is at our Eastern location. We have two locations, one in Henderson, one in Las Vegas. We've actually been able to grow during this whole crazy pandemic year. So we're really proud of that. We've actually added on two physical therapists. We've onboarded another chiropractor, and I think it's really a testament to what Shane was saying. We're really trying to help a lot of people, and we've gotten a lot of good results with blending fitness, performance, and healthcare together. My room here is, it doesn't have the big machines and the real sexy things that cryos and things like that, because I think a lot of that is fluff. If you get down to the necessities of what physical medicine really is we're trying to get people to understand movement and get back to movement. Most of the time when people come to me, it's because they can't do something at one point in their life. They're really having a struggle picking up their kids, For Shane, he's got all sorts of stuff that he wants to do all the time, so I have to try to keep up with him. You know, he wants to rock climb, he wants to do all sorts of stuff. You know, that's his goal, but he gets limited by something, and he tells me, so I need to come up with a game plan on how to get him back to do those things. That doesn't take sexy equipment. That doesn't take big cryo machines. That doesn't take big, big units of really crazy machines. It takes learning how to understand biomechanics, having a one-on-one interaction with a patient, and having tailored movement plans for patients to get back to what they want. So that's my clinic. Like I said, that's one of the. Oh, of course, now it shows up in the background. Sorry, I'm not the best at creating these whole slideshows. I'm going to get better though, because I'm having more people ask about Elevate, so I need to get better with that. But this is some of my team. The top three: myself on the left, Kathleen, Brian. These guys are my business partners. Kathleen does a lot of business administration, business ops. Brian Chandler is the director of performance. We work with a lot of very intense athletes, and he's a wizard on making them perform better. We got our physical therapist, Zach Couples, after that, a whiz with rehab. He does a lot of really unique approaches to physical therapy. Next is Fernando. He's in the glasses, and he's our massage therapist and recovery specialist. He does a lot of stuff with post intense exercise. He's very helpful for me in patient care when I can refer out to him. After that, we have Brad, who's our director of fitness. So like Shane was saying, we do have a integrated clinic here. Our clinic is full of they all have different responsibilities. One of our big aspects is team training. So we have some small groups, large group type training. He does all the programming for that, and he has a lot of golfers that he works with. Amanda is one of our coaches. She runs a lot of those team trainings. She is getting ridiculously smart with how much she understands about anatomy and biomechanics. So she's very valuable for people starting the whole fitness journey. And Francis, big red beard, hard to miss. He is our director of patient interaction and client interactions. So he does a lot of our social media. He tries to make the best experience. I'm sorry, he's our experience director. I couldn't get the term out of my mouth, but he's the director of experience. So trying to make, when someone walks into Elevate, we're trying to make them feel the best possible, and he's constantly coming up with better ideas for how to make that even better. And every day he's trying to figure out how to make that better. He's also a coach. He does some of the custom and team training as well. So there's our team. This is my wife and my dog, Kelsey, and my dog Zeke. We go out and we hike and we do all the stuff that Vegas has to offer here. So just a little background on me. Want to kind of not just be all business. Want to talk a little bit about my passions and stuff too. But these guys are awesome. My dog is awesome. So focus points for when we're talking today. We want to talk about Elevate's mission. So this was something over the past year when we were in our shutdown, we really tried to focus in on. We really tried to hone in on what is it that Elevate is truly trying to bring to the world. So I'll go through that. Our why, like what makes this so important to spearhead a new type of delivery for healthcare and fitness. And then finally, we'll talk about my personal and some of my clinicians that work underneath me, our approach to healthcare. So those three things are going to be the focus points, a couple of slides for each of them. And then we'll get into the Q&A like Shane was saying later. But I don't know if anybody's seen the meme, but Barack, he talks about focus. These are our focus points. So You can write 3 of your little check marks down and start filling in on our mission. Our mission is going to be the first one we talk about. So the mission, to provide the world with physical freedom. A lot of people don't understand what physical freedom means. It's kind of a slogan that we have for ourselves. And to better, I guess to better describe what physical freedom means to us and what we really want to people to understand is we ask them a question. So someone has an inquiry about they want to work with us. They don't know if we can help them. They just have questions about what Elevate does. We'll usually cue a question. We'll say, have you ever had something in your life that has been limited because your body won't let you do it? Most of the time people will say, yeah, there's something that I'm currently struggling with. I can't walk because my ankle's broken. That's shame, by the way. And there's been other things, like I want to be able to drive the ball 300 yards down the fairway, hit the green every time, blah, blah, blah. But they're limited by their body. That's when we get these true ping points of what makes it so important for them to get to their goal. So when we try to really connect with a patient, a client, we really try to get what it means for them to have physical freedom, and we attach that to this slogan here. So that is our mission. And then we try to connect the dots between their physical freedom and how we can help them. So again, our mission, we think it's a really powerful saying, but it almost always cues a question, and then that gets a good interaction, so we can bring it back to a personal connection to them. So it's not just this foreign slogan, physical freedom. It actually means something to them. Getting my ankle better because I want to go out and rock climb again means something to someone. Some people say it's mission impossible to bring physical freedom to the entire world. We're up to the challenge, and we're going to continue to grow. So that's the promise to the world. Is we're going to always going to go after this mission of bringing physical freedom to the world, and this is how we do it. So our why, I guess I shouldn't say this is how we do it. We'll talk about that in a little bit. But our why. When we created Elevate and we took over Elevate, it was actually a previous business that we didn't like how it was going, and thought that it needed a makeover. So we were going to either go on to our own ventures, or we decided to team up. But our why. There's a broken system. I don't know if anybody knows this, but there's a broken medical system in the nation, and it is very sad to see a lot of patients get put a number on, and they're just a mill product. They show up and their insurance pays for this, and this is what they get. And they get handed off to an assistant, or they get handed off to someone else and say, do this sheet of exercises. Here's a stem pad, and we're going to put this on your back, and it's going to make you feel better. And it's not because there's not a lot of good clinicians out there. It's not because there's not a lot of good physical therapists, chiropractors, athletic trainers. It's not because of that. It's because they are forced into a model that makes it turn into a mill type product. And we are trying to break that mold. We're trying to make the new standard of providing healthcare, providing fitness, individual, and have approaches that can help people as opposed to numbers. So the broken system is definitely a big reason and a driver of why we created Elevate and what drives us and creates our passion for what we're doing. We also want to have clients and patients have hope. I think the biggest thing that I see with a lot of patients that have gone through a mill type product is you just feel like that's the best that there is out there, and it's not. There's definitely better. Having ultrasound and stem pads put on, there's a time and a place for that. But if that's all you're getting, if that's all a patient is getting for their pain, and there's no template, there's no outline of where they're going to go, there's no hope, there's no context to finally get to a better place. So whenever we have a patient interaction, we want to try to build this understanding that you are here at this point, but you are not going to be here as we get through more and more treatment. It's going to be dynamic. There's going to be things that change with each time that you're being worked on. We're going to listen. We're going to be able to have that communication between provider and patient, and come up with goals and come up with steps to get to your final destination, which is trying to get you your goal, whatever it is your physical freedom is. So a good tie in there. Our why, again, maybe another step would be that we want to be the one-stop shop. This goes back to the broken system a little bit. If we have a trainer, we have a physical therapist, we have a chiropractor, we have a nutritionist, and they all want to help this person. If they don't understand how that, like, each entity is helping each other, there's going to be things that are lost in translation, especially I think on the medical to fitness side of things. Obviously, I might have a bias here because I hear it more often. Maybe if I were to talk to our nutritionist, she'd be like, no, it's more nutrition and fitness that have the things that get slipped through the cracks. But for me, I constantly see patients that will come in and they will say, my trainer has me doing this. I went to go see my physical therapist, and they told me to do this. They get left with this question mark on what to do. They need a team, and that's exactly why we built what we're currently operating under is a team-based approach, an integrated-based approach to fitness, performance, and healthcare. So our coaches, so we go back to that team, Amanda, Francis, Fernando, these guys all do coaching. If I want them to establish more hip flexion in a patient that previously had back pain, now I know exactly what to tell them. I know exactly, okay, I want you to stay away from these movements, and I want you to integrate more of these movements. But coming from their medical provider, there's no loss in translation. If they have questions as coaches, who do they ask? They can ask me as a medical provider and say, okay, well, I'm trying this. Is there anything else that I can move on with, or I can get them better with? And of course, there's going to be a gradient. If a patient is in a lot of pain, I'm not going to just send them over to the gym side and just say, okay, go for it and see what happens. If they got to kind of get checks and balances at some point, they have to check a box off where their pain is low enough to start integrating back into the fitness side of things. And then once that happens, there's that transition. There's going to be a conversation between me and maybe one of the coaches that work closest with them and say, hey, I want you to start integrating this movement first, and then maybe start adding in X, Y, and Z. So that integration is huge between the clinical side of things, the massage recovery side of things, the nutrition side of things. So we all have one big team is what one-stop shop approach is. This next graphic, we actually send this out, or we have this in the front of our website, and we also have this on pamphlets so that people understand our model a little bit. Just like I said, the gym, the spa, the nutrition, the chiropractic, physical therapist, we don't want people to have to go to a bunch of different places, waste time, and potentially have things that get lost in translation between any of these professions. These are all very, very important when it comes to people's healthcare. So if one of these are slipping, or one of these have, slip in their translation to another profession, we're going to be losing the patient, the client, a little bit. We're not going to have the best reaction there. So again, we're trying to be that one-stop shop for everyone. We want to have all these things be able to communicate as one unit and work better for the patient. We think this visualizes very well for anybody that has a problem, and they understand all of our services that can help there. So, Um, elevates healthcare approach. This gets a little bit more individual towards what I do. We'll talk a little bit about the gym side of things, but elevates healthcare approach. We want to, again, when we look at this broken system, a good way of thinking about it might be if you give blood and you have all these markers, then all these markers are within normative ranges. What's a typical MD gonna say at that point? If there's nothing outside of the lab ranges, they're gonna be like, oh, well, you're good. What happens if you look at all those numbers and you look at all these trends, and it's like right on the cusp of being bad, being something that you need to change? That's not a proactive approach. It's more of a reactive approach. We're going to wait until it's in the red, and that's not good. That's really a bad way of looking at healthcare. So the same thing that when I'm working with a patient, you know, if there's no pain, that doesn't mean that there's not things that I can't help them with. You know, if we go through a movement evaluation, we say, okay, this moves this way, this moves this way. There's a limitation from right to left. That might give us the inclination that there might be something later on that goes wrong. So having a proactive approach to the clinic side, that's where our movement evaluation comes in. We try to get people moving so we understand not just a picture. Anybody can take a picture of someone and say, okay, well, this looks like a healthy 33-year-old male. But when you get them moving, then you truly understand their biomechanics a little bit more. You understand how they're going to react when they're doing what they love to do. And that might pose some yellow flags and say, hey, hold on, before you start going and throwing a football, you need to work on this shoulder mechanic because it looks kind of funky and it might end up causing some sort of irritation into a structure. Same thing on our gym side. Anybody that goes into the gym side, we go through a movement assessment. We have to make sure that we do our checks and balances on the gym side that, okay, can you squat? Can you do these range of motion in your hips? Does your upper back actually turn? Can we put you in a jumping setting? All that stuff has to be established on the front end so that we know that we're not going to put them into a box where they don't belong yet. All of our approaches to both the clinic and the gym side have progressions, and we try to make sure that our starting point is not going to regress someone. It's not going to make them worse. So we always measure. We always try to make sure that we clear boxes. Once we have that assessment on file, it's communicated to anybody that's going to be working with those clients, and this is specifically on the gym side, that everyone knows what's going on with Sandy, with Jim, with Larry. If Larry has a shoulder and we need to take him out of an exercise, or we need to be very focused on his shoulder, everyone knows that as a team. So we can go in and we can look at all the files of people that have gone through an assessment, and we understand a little bit better. In our healthcare approach, I think, is different in another way, is having time with a clinician. That sounds kind of basic, but if you go into a traditional healthcare setting that's run by a mill setting or something where time is very limited, you'll see a doctor, potentially a physical therapist, chiropractor, MD, DO, any of your professions. You'll see them maybe on the front end. You'll see them for a short amount of time. You have to try to barf out as much information as you can to them, and there's a couple of different routes. Whether if you're in a medical setting, they'll say, okay, well, try this medication, and I'll see you in 6 weeks. Or if it's a meal type product, then they'll say, okay, here's your stretches for the next 6 weeks. Work with this person over here, and I'll see you again in 6 to 8 weeks. All of our care on the clinical side is done with our physicians. It is physician level hands-on care the entire time. You buy a clinician's touch, you buy a clinician's thought process for the entire time that you're working with them. And that's very rare, I believe. not a lot of times that you get to work purely with the physician the entire time. You want to ask questions. You want to have a conversation about what you should do outside of here. All of that stuff can be asked. You have plenty of time with our clinicians. Obviously, sometimes there's more things that can be asked outside of the time allotment, but you've definitely given more than a 3 or 5 minute conversation or barf of information onto a clinician. We have time. We have the ability to put on physician level hands-on care. We can listen and we can actually let that patient know that we care about their well-beings, as opposed to just getting on to the next patient. So those are Elevate's healthcare approaches in terms of time allotments and our thought process going into the clinic. So how a doctor at Elevate is supposed to think about their clinical intervention for a patient. These things are like kind of our Bible or our mantras is reset, reinforce, reload, the 3 R's. So this kind of gets into a little bit more of the individualistic approach that each Elevate provider has on modulating pain. So for me, I like to use my hands. I like to do a lot of hands-on work, whether I'm getting someone to move while I'm changing the pressure on a muscle, while I'm changing the pressure on a tendon and neurologic bundle. But I like to get them to experience movement with a different input. So say a patient were to raise their arm up and it's like, that feels crappy. It hurts top portion of my shoulder when that happens. Something that I'll look at, if it's limited in certain muscle tissues, I will see if I can place a contact, whether it's my hand, whether it's a tool, whether it's a cup. Place my hand onto certain areas and see if I can create that movement with a reduced amount of pain. So there's things called ART, active release therapy, stecco, fascial manipulation, like I said, cupping. All of these things are pain modulators. And if you've heard of cupping, you've heard of like tool work, Graston, those things are very common. I think it's the follow-up that needs to happen is reinforce, so we don't pick the scab. So the reinforce is having a conversation on figuring out what it truly is that's causing them to chronically irritate this tissue over and over again. I had a very prominent role in I think he's a physical therapist. I don't know. Because physical therapist or a chiropractor doesn't really matter because I think long term we should probably drop those as terms because there needs to be a blending of both of them to have a really, really good physical medicine provider. But this guy, he was talking about, if you really truly want to get to the depths of the reason why people are having pain, you need to figure out why they acutely hurt themselves over and over again. He doesn't believe a lot in chronic pains. He believes a lot in chronic irritations. Like it just happens to be irritated over and over and over again. If you start taking away some of those little acute irritations, then it doesn't become chronic pain. So education here at this step number 2, this reinforce, is massive. Like we want to have this be very high on the list because then the patient leaves empowered. We always talk about this word empower when I'm talking with the other clinicians. We have to empower them to take what they learned at Elevate and bring it home, because I only see them for maybe once a week, twice a week, and it's for a time period that is minuscule compared to the hours in a week. So what they learn during that time is very important because they can extend their treatment throughout the entire rest of that week given that they're doing these things. So the reinforcement is that education piece. They need to take that home. They need to understand what it is that they truly shouldn't be doing or should be doing more of. And then finally, we look into the reload pattern. This is where this Masters of Sports Medicine that I have, and the focus and the drive on getting people to move again and get into some sort of resistance type training really shines through. Whether they did resistance training before or not, again, rehab is a spectrum of resistance training. You start from really low load and you try to get them to progress along that rehab gradient to end up being, you know, hopefully self-sufficient or being able to load themselves up as much as they want. But we have to figure out where they start. Their start point is really important on the reload aspect, whether it's starting with no weight and body weight and just, you know, figuring out movement, going through movement at a very efficient pace. And then finally, you know, going into resisted, weighted, dynamic, accelerated. There's this whole pyramid of things that happens. You have to first figure out how to move, then you figure out how to move with a little bit of strength or a little bit of resistance, and then you finally get into speed and acceleration, and finally sports specific. So that reload portion is a pretty big spectrum, but that's the 3 R's that our clinicians operate under is reset, reinforce, reload. What can I do to change their pain? What can I do to change them from irritating themselves all the time? And then finally, what can I do to make them freakishly strong at the areas that they didn't have before? And that's what creates resilient patients. That's what creates resilient humans. I know Shane can attest to this. Being strong gets rid of a lot of things that could irritate someone that is not strong. That is our 3 R's. And our another thing that we usually talk about is we just want to change the way that health is achieved and how healthcare is delivered. And I think we're doing that through the model that we have. Our team is incredible. It's all about the people that you put around you. The team that we're starting to expand, like I said, is gonna do incredible things. It's not just gonna be a couple of small clinics that's gonna change the world, and that's our mantra. We're gonna keep on going towards it. So we don't think that it's impossible. Like I said, that Mission Impossible meme or that GIF that was on there earlier, those things. We try to keep that out of our vernacular. It's hard. It's definitely hard to change the medical setting, but we believe it starts here. It starts as this integrated approach. We want to have a whole new world. Ha ha ha! The Aladdin, whole new world. Here it comes, coming. If you guys have any questions, I hope that you would reach out. These are our handles at IG. This is our website, and again. Something on our website that I don't know if this is the right time to talk about it. Shane, sorry, I forgot if you told me to hold this or not, but we have these, we've, over the course of the last couple of years, we've created this thing called a Doc Talk. Myself and one of my physical therapists have spoke about a lot of different topics. We've talked about cervical pain, we've talked about headaches, we've talked about back pain, knee pain, when to get an MRI, when to work out with an autoimmune dysfunction. I mean, just all sorts of topics. And it's on our blog. So Elevate SPH, if you have a burning question and you either can't get a hold of me or check that stuff out, because there might be something that would give you an answer. It's on there, free content. Just go on there and check out all the topics on there. We have a bunch of stuff on there. So look for us on Elevate SPH for IG. We have a lot of good content on there as well. Kind of tells you what we're up to. Some training tips, gives you nutritional tips from our nutritionist. And again, if you guys have any questions, please reach out. I thank you for kind of tuning in and hearing our passions and our goals.